out at Atkins Archery, out in, I don't know where we are, but we're out by Essex someplace. And
Ontario.
Jerome, the owner, is shooting with both eyes open. And he's been doing it, how long have you been doing it?
About 10 years, both eyes open.
And apparently you're pretty good at it because you get your deer every year and you get your moose every year, so, you know, that's a good thing. So what 3 things could you say to shoot with your both eyes open?
First, you have to make sure you're shooting with your dominant eye. So if you're left-handed and you're shooting, you got to make sure you're left eye dominant.
So one of the best ways is just put your hands like that and hold it
back.
up and close one eye, close the other eye, and whatever eye is still on the
target, that's what eye you're dominant with.
That's your dominant eye, so that's a quick way to do it.
So if you're right-handed and it turns out you're left eye dominant, you should, if you want to shoot both eyes open, you really should learn to shoot left-handed.
Yeah, and I'm right-handed, but my left eye is dominant. I shoot like this.
And I'm left-handed, and I get right eye dominant, and I shoot right-handed.
But if like you're normal,
yeah,
and you're right-handed right eye, then it's a whole lot easier. But that's, you know. But we're trying to teach you how to shoot with both eyes open. When I start with my left eye wide open and this one shut. And as I draw, I open up as much as I can, but I can't open as much as you. You just start with your both eyes wide open.
And that comes with practice.
And
I would suggest that if you want to learn how to shoot both eyes open, that's exactly what you do. Start real close to your target so you know you're not going to miss it.
Yeah.
And I mean like real close. If you got to be 3 feet from it, then be 3 feet from it. Yeah. And do the same thing. Close your one eye like you normally do if that's what you're used to doing. Focus on the target, then open your other eye, make your shot. Practice that for a week or 2, then start to back up until you're comfortable. You know, say 10 yards, and keep practicing like that. And then the next step after that is go back close again and start with both eyes open. By that time you've started to train your eye to be dominant with both eyes open. Yeah. And then practice, lots of practice.
I'm here at the Angema Eye Institute down in Leamington. I'm talking with Dr. Christopher Angema. And because I'm an older shooter, my eyes needed checking. So I would suggest, if you're not hitting the target, you're not hitting the deer, you're not hitting anything, you might want to get your eyes checked first, because that's the first place to start shooting both eyes open. So doctor, what should somebody look for if they find that their vision's getting, if not, they know something's wrong? What should they look for?
The biggest things that people notice initially especially with hunters, is they notice that they can't focus on a pinpoint object. So if you're used to using a red tip on your sight, or if you're used to following an animal against some camouflage, you'll lose them when they get to a certain distance when you used to be able to see them further.
Yeah.
If you're a duck hunter, for example, you're following a pinpoint object in the sky, and you can't see that anymore at the same distance.
Yeah.
The other thing that people will notice is that they lose their vision in lower light. So if you're an early morning duck hunter,
prime time hunting.
Right, exactly. So I'm a deer hunter.
Oh, okay.
So if you're hunting in sunrise, when you're trying to find a deer against shadows, you lose that contrast and you can't see them very well. So everything kind of gets grayed out. Same if you're in your boat ready when the sun comes up to duck hunt. Yeah. That sort of gray tones, or then in dusk, when you're coming in from your hunt, you can't see as well.
Okay.
If you're driving, you're bringing what you brought in for the day in, and you're driving, you'll see halos and glare from oncoming lights. Yeah. So if you see a spotlight coming in around, especially those halogen beams, you'll see rings around those, and you just can't see as well. It's almost like a sparkle.
Well, I noticed when I was deer hunting last year, and I pulled my bow back, and I'm left eye dominant, but I'm right-handed, so that's a whole other issue, and I can talk about that again.
Yeah.
But normally I would pick a hair on a hair, a spot on a hair in the deer,
yeah.
And all I'm seeing is a brown blob. I'm thinking, something's not right, so that's when I called you up, and we started checking my eyes, and we found that my cataracts were a little cloudy.
Yeah. So
that normally happens with people over, what, 50, 55?
The average age for most cataract patients runs somewhere between 65 and 75. Though patients though patients who spend a lot of time outdoors, so lots of UV exposure since childhood, will increase the development of a cataract.
Because normally I don't wear sunglasses.
Right. And so UV protection will push that age back.
Okay.
You know, but UV exposure, diabetes is the other one.
Okay.
So people who have diabetes on average get cataracts 20 years earlier.
Oh, wow.
So our average diabetic patient with cataracts is in their early 50s.
Mm-hmm. So what's the difference between, you hear about laser surgery and the kind of surgery you do? What's the difference between the two of them?
So laser surgery of the cornea, or what we know as LASIK,
Mm-hmm.
is a surgery where we take a laser and we basically burn the front window of the eye or the cornea.
Right.
We basically reshape that, and that helps to give you better distance vision. And that's a surgery that's usually done in people who are 20 or 30 years old.
Right.
Most patients, most people once we get over 50 develop lens changes
Mm-hmm.
that we call cataracts.
Okay.
So the surgery that we do, that I do in your case for
Mhm.
cataracts, is we use an ultrasound and a laser in combination to remove your natural lens,
Mm-hmm.
and then we put in a lens implant. And that goes behind the cornea, and it's different than a cornea surgery.
And it takes about 8 minutes to do it, and there's no pain involved, and there's a little bit of recovery time, but it's pretty simple, like on my side. A little complex on your side, but it was painless. So yeah.
Yeah,
Okay.
very good.
And when you're ready to shoot with both eyes open, you got your safety glasses on, you got your hearing plugs in, get your sight picture, and the safety's off, and you pull the trigger. See what you get.
So before you pull the trigger, you focus on your rear sight, then you focus on your front sight, get it lined up as best you can, and squeeze the trigger. And practice, practice, and practice some more. Work with archery gear and all sorts of firearms. Check it out. I'm Peter Wood, field editor with Ontario Outdoors. Special thanks to Atkins Archery and APA, Dr. Njima, and Charlie Summers. Shooting with both eyes open.